Hi, I'm Dr. Hassan Farooq, hair restoration surgeon certified by the American Board in the hair restoration surgery. Today we have Mr. Ryan with us. The reason to bring him over here is for the reason that he is a typical case of the androgenic alopecia. As per his history, he doesn't seem to have any illness, no smoking, no family history of any other illness except the baldness that runs in his family on the both father and the mother side. So it seems to be that very typical case for the male pattern baldness or the androgenic alopecia. So if we examine him, as we can see, if you can please Mr. Ryan, make head down. This zone 1, like which continues just behind this frontal hairline, and then the zone 2, just behind this central part, starts your zone 2, and then behind your zone 2 starts your zone 3, and then your zone 4. So in this case he is around, if we take the Norwood classification, comes around to be around 5 or 6 category for the male pattern hair loss. In this patient, to have a good quality results, it is very important that we examine the donor area first. The donor area which extends just beneath the external occipital protuberance. So in order to achieve good quality results in this patient, it is very important to look for the donor area. So if you see, he seems to have a very good donor area, which is extending from his external occipital protuberance. This point, usually in males, is regarded as the last limit where the hair fall occurs. So we just palpate this external occipital protuberance, which is over here, and then we just take 2 finger breadth above this point to mark the area for the upper limit from where we can harvest the maximum amount of the hair. Then we extend, if you can turn to this side please. Then we take the middle of the ear and extend the line upward, and then we unite these lines like this, and similarly on this other ear. This would give us the exact donor area from where we are able to harvest the maximum amount of grafts in single session. It is also very important to know that the amount of hair which he has lost is twice the fold of the hair which he already has. So even if we transplant all the hair at one time in the recipient area, it wouldn't show any difference. So in this case, if we see the donor area which he had, which I have marked over here, is the safe donor area from where we can harvest the maximum amount of grafts. It is also important to know that we cannot cover the whole head in a single session. It normally requires 2 sessions to complete, from the zone 1 covering until the zone 4. Okay. So in the first session, I have my target, for example, to harvest around 3,000 to 3,500 grafts, which would be good enough to cover in a single session up to 70% of the 60 to 70% to be on a safer side of his head area in a single session. The second session in males is usually required to cover some part of the zone 3 that is left in the first surgery, and the 4 zone that should be done in the next procedure. So which brings out the maximum yield and the best results out of the hair transplant. So Mr. Ryan, he is a very good candidate for a hair transplant surgery, as I told you earlier regarding his donor area that is very strong, and we can easily perform 2 hair transplant surgeries with the interval of about 1 year ideally. So in the first session, as I told you, we would be covering around 70% of his bald area, that is around this vertex to the finger point where I have pointed on his head. So this area will be good enough to cover even the crown area once the hair grows. But however he feels like comfortable, he can always come to have a second session done, and in that session we would be able to cover some part of the remaining part of the zone 3 and the zone 4. So please feel free to contact me by the numbers which are given on the website or the numbers given on the screen, or you can have a free consultation with me during the office hours.